Hello and welcome to today's episode. I'm Dr. Hamza Mahmood, and I'm here to guide you through an important topic that many overlook: oral cancer. Whether you're listening on your morning walk, during a coffee break, or in the comfort of your home, I want you to feel informed and empowered by the end of this session. Let's begin. Segment 1: What is oral cancer? Oral cancer refers to cancer that develops in any part of the mouth, the lips, tongue, cheeks, the floor of the mouth, the hard and soft palate, sinuses, and throat. It usually appears as a persistent sore or growth that doesn't go away. Why should you care? Because oral cancer can be life-threatening if not diagnosed and treated early. The survival rate drops significantly in later stages. Now, let me break this down. Oral cancer is part of a larger group called head and neck cancers. Among these, it's one of the most common but also one of the most preventable if we act on the risk factors. Segment 2: Who is at risk? Let's talk about risk factors. Understanding them is the first step in prevention. The biggest one? Tobacco use: cigarettes, cigars, chewing tobacco, snuff, you name it. Combine that with alcohol consumption, and the risk multiplies. Then comes human papillomavirus, or HPV. This sexually transmitted infection is now a leading cause of oral cancer in younger adults, even those who don't smoke or drink. Others include excessive sun exposure, for lip cancer, poor nutrition, a weakened immune system, and a family history of cancer. Men are more likely than women to develop oral cancer, and it mostly affects those over 40, but remember, anyone can get it. Segment 3: Signs and symptoms. So, how do you know if something's wrong? Listen to your body. These are signs you should never ignore. A sore in the mouth that doesn't heal after 2 weeks. Pain in the mouth or ear. A lump or thickening in the cheek. Difficulty swallowing or chewing. Red or white patches in the mouth. Numbness in the tongue or jaw. Loose teeth without dental explanation. Voice changes or a sore throat that lingers. If you experience any of these, don't wait. See your dentist or doctor right away. Early detection can literally save your life. Segment 4: Diagnosis and screening. Now, let's say you go in with symptoms. What happens next? First, your doctor or dentist will perform a physical examination of your mouth and throat. If something looks suspicious, they may take a biopsy, a small tissue sample, to be examined under a microscope. In addition, imaging tests like CT scans, MRIs, or PET scans can determine the spread. Screenings are vital, especially if you're at high risk. Many dentists do routine visual and physical screenings during your checkups, but if you have multiple risk factors, ask for a more thorough screening. Segment 5: Treatment options. Okay, now we come to treatment. What are the options? Treatment depends on the stage of the cancer, its location, and your overall health. It may include 1. Surgery, to remove the tumor and possibly some nearby tissue or lymph nodes. 2. Radiation therapy, targeted radiation to kill cancer cells. 3. Chemotherapy, often used in combination with radiation for advanced stages. 4. Targeted drug therapy, blocks specific pathways cancer cells use to grow. 5. Immunotherapy, boosts your body's natural defenses to fight cancer. Post-treatment may also require reconstructive surgery or speech therapy, depending on how the treatment affects your ability to talk, eat, or breathe. Segment 6: Living with and beyond oral cancer. Surviving oral cancer is not just about treatment, it's about recovery. You may need support from nutritionists to help you eat well, speech therapists if speech or swallowing is affected, psychologists for emotional support, and a strong social network of family and friends. Routine follow-ups are essential to monitor for recurrence or complications. Segment 7: Prevention and self-care. As your doctor, my goal is not just to treat, but to prevent. Here's how. Quit all forms of tobacco. Limit alcohol intake. Protect your lips from the sun. Maintain good oral hygiene. Eat a balanced, nutrient-rich diet. Get vaccinated against HPV. and schedule regular dental and medical checkups. Also, perform monthly self-exams at home. Use a mirror to check your tongue, the inside of your cheeks, gums, and lips. Feel for lumps in your neck and jaw. Segment 8, Real Stories and Hope. I want to share something with you. Many of my patients who've gone through oral cancer treatments are living full, joyful lives today. They work, raise families, travel, and even run marathons. Early detection, timely treatment, and a strong willpower are what make the difference. Remember, oral cancer is not a death sentence, but ignorance can be. Before we wrap up today's episode, here's what I want you to take away. Be proactive. Listen to your body. Don't ignore symptoms. And most importantly, take control of your health. If you found this episode helpful, share it with someone you care about. Leave us a review, and follow our channel for more health-focused episodes that put you in charge of your well-being. Until next time, this is Dr. Hamza Mahmood, signing off. Stay informed, stay healthy.